Hello and good afternoon, everyone. All right, today we have some more safety training to go over. This week and maybe even next week is going to be kind of safety training heavy. Just we have some things to get caught up on, and so all the staff are doing it, so we're gonna do it, and it's really good for everybody to be on the same page. All right, so it's true. But this one shouldn't take very long. And along with COVID, a lot of these questions are pretty easily answered. Of course, I'm going to go over and I'll tell you the answer, but if you have any questions, comments, or even ways that we can make things better, that would be greatly appreciated. So here we go. So the topic today is on infectious disease control. So things that can give you infections, such as bloodborne pathogens, basic illness such as flu, COVID, of course, lies in there, and just general safety as to how to stay clean, especially when it comes to infectious disease and possibly being infected with something, because we don't want that. It's bad. It's bad. I say bad. So, I'm going to go over some questions to really kind of go over what we're supposed to be thinking about. I want you to kind of answer these in your head as well. So take your time. You can pause the video at any time and just say, I'm going to give it a bit. And, answer the question yourself. If not, you can listen to my answer, which, of course, you should probably anyway, because I have the answers. The correct answers anyway. So here we go. So number one, there's about 11 questions. So I don't want to go over them too quickly, but I also hopefully won't straggle and take too long either. So number one, if you have a cold or the flu, what are some things you can do not to spread the illness to others? If you have the cold or the flu, what are some things that you can do to not spread the illness to others? Well, number one, stay home and take care of yourself. Don't come into contact with others, and you can't give them your sickness. So stay home, and please, that's the most important one. If you're feeling sick, if you're feverish, you're coughing, you've got, stuff coming out of your nose, you've got a sore throat, all of that means stay home. Nobody wants that. They don't even want you to have it. But if you've got it, make sure you don't be the one who goes around and be like, I don't care about everybody else. I want to see my friends today. I'm going to cough all over them and make them sick, and then make our van a tiny incubator and make everybody else sick in there with all the particles and the grossness. And we don't want to do that. So stay home. That's the number one thing. Another thing to do is make sure you're washing your hands a lot. If you're touching surfaces, things like that, clean up after yourself. If you have a cough, you want to cough into your arm. You don't want to just and spread it. And luckily, right now we're wearing masks and things like that. But I did notice that a lot of people, they didn't do that. Or if you really need something, like I always have tissue in the van. So if you're sneezing, you need to blow your nose, ask for a tissue. But honestly, we're gonna be much more diligent. If you seem sick at all when we're back to full time, and you're coughing or sneezing, we're going to ask you to stay home. If we notice anything, it'll be like, no, seriously. We learned from COVID that this is how to stop the spread of anything. So that's what we're going to be a lot more diligent on. Okay, so that's number one. Number two, if you have a bathroom accident and did not make it to the restroom on time, what should you do? Well, don't panic. First things first is you should notify somebody. Try not to depends on if the accident, where the accident is. If it's pretty obvious, just let staff know, and we will help assist you. And we will get you the proper PPE in order to help clean yourself up as much as possible and keep yourself as clean as possible. But so, one thing is, don't be embarrassed. People have accidents. It happens. It is embarrassing, but it's not a big deal. It happens to so many people that I know and has. So, but you do want to make sure that you get to a bathroom. Let your staff know. Let the staff get everything that they need so that they can put their PPE on to help you if you need help. But they'll guide you to a bathroom, help you, make sure you get cleaned up, and then they'll do their best to contact either your family, seeing what's best for you, to have somebody come pick you up. Because really, the best is we wouldn't want you riding around in our van or anything like that, because that could spread that even more. If need be, then what we could do is we would figure something out for sure. But let staff know that's what you should do. Alert them so that they can, they'll be discreet about it, but they can get some PPE and get you the help that you need as soon as possible. And again, accidents happen. And the best thing is for you to probably get you to a bathroom, have you call your family, or we'll call your family. They can bring you a fresh set of clothes, can garbage bag up your other clothes, throw them away, or take them home, have them washed, whatever you want. Say it's your favorite pair of clothes. But, depending on what kind of accident it is. Number 3, what are some things people do to not catch a cold or the flu? What can people get? Okay, so what are some things that people do to not catch the cold or flu? Again, washing your hands, right? That's one of the most important things, is to wash your hands. Make sure that you're diligent when, you're using the restroom, things like that. If you're use hand sanitizer, bring hand sanitizer with you. We always have that in the van as well. There's also wipes that you can use. Make sure you're always drinking plenty of fluids. That's an important thing. You're keeping your body healthy. The more you do that, take vitamins, things like that, that are recommended for you, but also just for your general well-being. It's best to, if you're feeling healthy, then everybody else should be then you're going to be healthy. But, all right, it's kind of redundant. But if you're treating your body healthily, you'll be able to fight off infection. What do they say? An apple a day keeps the doctor away. But it's true of just, eating generally well. And what can people get from their doctor or health clinic that can help protect them from catching the flu? We get them sometimes a program, but most of the time they're free wherever you go to Kaiser or anything like that. Get a flu shot before flu season hits. I definitely got mine this year. There have been some years that I forgot to get mine. Some people don't believe in it. They say, oh, it actually causes flu-like symptoms. And I was worse because of it. Pardon me, the science honestly says the opposite. So I go with the science on it. It's best to, prevention is the best thing. Number 4, why do you want to handle sharp objects such as needles, broken glass, razors carefully? And if there is broken glass on the floor, how should it be cleaned up? Okay, well, why should you handle sharp objects such as needles, broken glass, razors carefully? Because they can cut your skin. And then what happens? What happens is if you open up a wound, then it's exposed to the air. It's also exposed to whatever's been on that needle. And all of that gets into your bloodstream. And that's a bloodborne pathogen that can get in and cause an infection very quickly. All sorts of different infections. That's why you want to handle everything. That's why there's things like tetanus shots and things like that. Like if you step on a sharp object, they'll have you go to the hospital and get a tetanus shot. So you don't develop lockjaw or things like that. You want to make sure that, because anything that can cut into your skin, and you've opened up a wound and you've exposed it to something that, like I said, you don't know what was on a needle, or who's been touching that broken glass, or where the razor's been, what people have been using it for. People could be using it for all sorts of things. There could be blood already on there from somebody who's been sick with who knows what. So this is why you want to be very careful when you're handling sharp objects. And if there's broken glass on the floor, how should it be cleaned up? Well, I'll tell you the way it shouldn't be cleaned up as well. But what you want to do is block off the area. Get a broom, get a dustpan, and you want to sweep it up. You do not want to touch anything with your hands. Don't do that. Even if you have gloves on. The plastic gloves, easily to cut through. You get a pan, you get just a dustpan and a broom, and just get that in there. Keep it away from you as much as possible. Put it away. Do that maybe 2 or 3 times to make sure you get all that glass up. But again, you want to block off the area so it'd be like, hey, there's broken glass here. Don't want anybody stepping in it. Anything like that. So, that's number 4. Number 5, why is it not a good idea to share combs, hats, toothbrushes, or eating utensils? Okay, and I've seen people do this all the time, sharing food. It is not a good idea. Please don't share food. Unless it's your significant other and you're out on a date and you're being cutesy and feeding each other. It's not to do with your buddies who you don't know where they've been. And in fact, I don't think I've had a girlfriend that I've ever done that with, unless I lived with them, because I don't know where they go. Not to be mean, but I don't. I'm very careful that way. So, but you can get diseases of the mouth. You could get, what's it called? They call it the kissing disease. Herpes, yeah, where you get it on your mouth and you'll have mouth sores for their. I mean, again, you don't know where their mouth has been, so don't share food. It's not good. You don't know where everybody's mouth has been. And sharing hats, combs, toothbrushes. Well, toothbrushes, ugh, no, just please don't. Besides that, it's gross. You're taking somebody else's germs, and again, you don't know where they've been, and you're putting them in your mouth. Hats and combs, you don't want to get lice. It's not fun. I've had lice. But it's because I worked at a place where there were lots of kids. And kids get lice. And when you get it, it's not fun. You have to stay away from people. And when you do, you have to stay home if you have lice until all of them are dead and you know for sure. So that's why it's not a good idea. Believe me, you don't want lice. Number 6, why is it a good idea to place a seat cover on a public toilet before using the toilet? Because a lot of people make mistakes going to the bathroom, and you do not know how clean that is. I wouldn't want to take a black light to a bathroom, any public bathroom, because there will be all sorts of things that if you're just sitting down on it, you have no idea what you're sitting on with your bare body. So you need to be very careful when that happens. So that's why those are very important. Just use those anytime you see them. Or even at program, make sure that you're using the toilet seat cover. You don't know. It's a public place. It's not like it's like, oh, I know everybody here. You don't know what they're doing in the bathroom, though. So you want to make sure that you keep yourself safe. And anything that you can expose anything to can get you sick. And you don't want to get sick. Not that kind of sick. Well, not any kind of sick, really. Number 7. What should you do immediately after using the toilet? Okay, well, immediately after using the toilet, you should flush it. Okay, don't just leave it there. Nobody wants that. But what they're talking about here is, of course, hand washing for 30 seconds, right? And there's a song that goes along with it. I mean, you can do A, B, C, D, E, F, G, H, and so on all the way down. But even that sometimes doesn't work. I think you should do that probably twice. But that's during the whole process. It's not just, so start with A, B. The minute the soap hits your hand, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S. There's also the happy birthday song, which some people, if you sing it, not like happy birthday to you, happy birthday, you want a happy birthday to you, whatever makes it happy and easy for you to remember. But make sure, and then after you, of course, clean your hands. I always take my fingernails just to get under there and just get your whole hand. You want to make sure you get in between your fingers, all that good stuff. And then, of course, you're going to rinse your hands off. That should be at least 30 seconds, but that's what you should do. Number 8, if you are injured and bleeding, what should you do? Well, number 1, you should stop the bleeding. And then you want to definitely ask for help. But stopping the bleeding is the most important thing. Especially because you don't want to leave that wound exposed for too long. The thing is that you don't want to put anything on there. Don't just pick up a rag off the ground and put it on there, or your shirt. You definitely want to get something, toilet paper for the time being would be okay, just to get it on there because it's somewhat cleanly. But then what you want to do is make sure you contact your staff, because what we'll have is a first aid kit, and we'll make sure that you're taken care of. But then, you definitely want to make sure you get that covered up, because, you're exposed and you're bleeding. And then as you let staff know, you let them know so they can put their PPE on, their gloves and everything, and get you all taken care of, get it wiped up, disinfected, and then they could put a proper bandage on it depending on how bad it is. Or if you wanted to do it yourself, you could. But honestly, depending on where it is, where you've hurt yourself and you're cut and you're bleeding, sometimes you might really need help. But you definitely want to take alcohol swabs. I know it's going to sting for a bit, but it's really going to clear that out from anything that might have gotten in there. Number 9, what should you do immediately after sneezing or coughing into your hands? Right, what should you do? You should definitely go wash your hands. Put some hand sanitizer on if there's nothing immediately, just to kind of get the germs off of there. But you want to wash your hands. These are spreaders. I'm touching this. I just now I'm touching. Oh, now it's all over here. Oh, let me touch my water bottle. Oh, I'm thirsty now. And then oh no, see, now you're just making yourself sick over and over. No. Oh man. Faucet. Soap. Right over there, water. I'm in the van. Hey, somebody, I need hand sanitizer. You don't even raise your hand. Just, hey, somebody, I need hand sanitizer. And then the minute we get to a place that you can go wash your hands, go wash your hands. Okay, so washing hands, very important. If you have conjunctivitis, pink eye, what should you not do? Well, 1, you don't want to rub your eyes. Don't do that. Number 2, don't come into program. Highly infectious, pink eye. Really, really infectious. Do not come into program. And what you should do is you need to contact your doctor. But what you should not do is rub your hands and go around touching stuff. Don't do that. It is highly, highly contagious. I haven't, knock on wood, had that one yet. But make sure you're washing your hands, not rubbing your eye. It's just going to spread even more. Just make sure that you wash your hands, contact a doctor, and do not come into program. In fact, don't really go anywhere in the public where you could get other people sick, because you don't realize, it's not fun to have pink eye, and you might wipe your eye and then just touch something, and then it's there. So you want to make sure that you're you don't need to quarantine, but you need to be very careful when it comes to that. Believe me, that again, I've worked with kids, and I've been around pink eye, and we send the children home. We say, sorry, this is unfortunate for you, but that's pink eye. You gotta go home. And finally, number 11, if your friend fell and hit his or her head on the ground, which caused it to start bleeding, why should you not touch their blood with bare hands? Okay, why should you not? Because of, we mentioned it before, blood-borne pathogens. So there's pathogens in people's blood. Again, if they're sick, there's all sorts of things that people can transmit to you, all sorts of infections and viruses that you don't know if they have or have not, because you don't know your friend's medical record. They might not. You might think you do. You'd be like, no, it's my friend. It's just fine. You don't know. And you need to treat everybody as if you don't know. So this is why. And what do? You want to help them. You say, hold on, let me get some gloves. And of course, if you're here with us, there are always gloves around. I have them with me pretty much wherever I go. I always have them in my backpack. And the other thing is that, you just got to make sure that you're ready to go and ask somebody for help. But you can direct them to help themselves. But until you have gloves or anything like that, you should not be helping them. So, and if you do get someone else's blood on your hand, what should you do? Immediately, you need to go wash your hands. You need to go wash your hands, and you need to report it. And there's a good chance that you should probably go get checked at your doctor. Just to make sure. I mean, call in and say, hey, this is what happened. Talk to your physician about it. Say, what should I do? There's a good chance they'll be like, well, come in. We can run a test and make sure that you're okay. Okay, well, this has been Infectious Disease. Sorry, I do tend to talk too much. It's just my way. Anyway, miss y'all. If you have any questions about this, please make sure to ask. But wash your hands. Stay safe. Stay home if you're not feeling well. If you got pink eye or anything like that, or lice, home. Flu, home. COVID, home. Cold, home. Take care of yourself. Get better. Come back strong and better than ever. Anywho, I'll talk to y'all later. Ciao for now.